Hospice is a nonprofit organization that provides a supportive in-home end-of-life care to patients and their families. To be eligible for hospice services, the patient must meet certain criteria. Life expectancy of 6 months or less, have a physician for medical management, no longer be undergoing curative treatment, and reside within the service area. Services provided by the hospice team include physician services, nursing services, home health aides, social worker services, spiritual counselors, bereavement counselors, medical supplies, pain management, and volunteer services. Hospice provides services regardless of the person's ability to pay, race, religion, gender, age, or diagnosis. Services are funded by insurance reimbursement, such as Medicaid, Medicare, or private insurance, self-pay, public donations, and volunteers. Hospice services are typically fully covered under Medicare Part A and Medicaid and most private insurances. These insurances pay for all needed medical supplies such as dressing supplies and appliances, catheters, depends, and etc. They also pay for medical equipment like wheelchairs, walkers, hospital beds, oxygen machines, and more. Prescription medication coverage is included as well. Hospice services are covered separately from other unrelated conditions so that the client can continue to receive benefits for those conditions. Short-term stays in nursing facilities for respite care are also covered by Medicare and Medicaid. If the client does not have insurance, the hospice provider cannot turn them away or deny them services. They will discuss with the client many options for payment and will provide services even if the client will be unable to pay. This is why nonprofit hospice groups are dependent on donations and volunteers. To be eligible for hospice services, the patient must have two physicians, typically their primary care physician and the hospital physician, and state that they have a terminal illness with a life expectancy of 6 months or less. The client will then have an intake interview with a hospice provider and sign a consent form allowing treatment. The intake nurse will do a complete assessment, thorough history of their illness, such as a medical history, medications thereon, surgical history, current physical limitations, assessment of support system and caregivers, what types of services they may need, medical supplies they need and use, medical equipment they need and use, what their worries, concerns, hesitations, fears, or stressors may be, and then the nurse explains what hospice will do for them. Once the client accepts hospice care, they can revoke services at any time by signing a revocation of services form. During my experience day, one client revoked her services with this particular hospice because they wanted a provider closer to their home in case of an emergency. If hospice services are stopped completely, Medicare and Medicaid benefits will return to the standard plan automatically. And if the client becomes terminal again, hospice services can be reinitiated without problems. Hospice is provided to allow for death and dying with dignity and comfort. The role of the hospice nurse is challenging because death and dying is not focused only on the client, it is family-centered care, and not every nurse is cut out to be a hospice nurse. During my experience, I only encountered one client that did not have family living with them to help with daily activities, although they did have a strong support system. Another client had many family members present and assisting with care, but there were also a lot of family issues and turmoil regarding care and caregivers. These clients would probably benefit greatly from volunteer companions. By seeing both ends of the spectrum regarding family-centered hospice care, I can see how it takes a very special person to do this job. The nurse must be excellent in therapeutic communication, empathetic, and be able to control her own emotions. These clients bring the nurse into their home, into their lives, and into their family, even if only briefly, but the memories they leave with the family last a lifetime. In conclusion, hospice is a great service for our community. They provide excellent care and support to our clients and families. We as healthcare professionals need to educate patients and families on the benefits of hospice and the services they provide. It is a gratifying feeling being with a patient and their family in their last moments, knowing that you have upheld their last wishes and kept them comfortable. I have been this nurse more than once, but I could not do it on a full-time basis. I give hospice nurses much recognition for the work they do every day.